Hello, this is a recorded lecture for Chapter 9, excuse me, Information Technology and Dentistry. As you look at information technology for all healthcare professionals, I think you're going to find that the last chapters of this book are looking more so at specific careers. And in this case, we're going to look at dentistry more specifically. When we look at education, we have to look at how we develop online education professionals. And so when we look at the dentistry world, there is a great deal of online education that goes along with continuing medical education pieces that help to keep dentists updated on the different techniques and treatments, modalities, and such. We also have computer-generated treatment plans for patients. As we do in the electronic health record, we may have that for dental patients also. Additionally, in the world of education, for in the dental world, there can be virtual reality simulations to help train new dentists in new processes and to train newer dentists in old processes. This is a computerized treatment plan you see, and they'll show you specific injury to what specific tooth, and it'll kind of follow through on what treatment's been done, what the treatment plan's going to be. Now, it can also have administrative applications in the world of dentistry, and that includes electronic appointment book, just like we do in a regular physician clinic. We can do scheduling, you can help with accounting, you can help with record keeping. So technology plays an important part there, and this is a good look at electronic scheduling system for a dental office, and it's Dentamax is the name of this particular record. Here's another one. Look at that. How to schedule out, if you will. This is looking at scheduling on a month basis, so we can see what's scheduled month to month. The other more important, I think, or I won't say more important, but more integral electronic technology-based mechanism is going to be the electronic dental record, and that's going to replace the big paper records just like they did in other healthcare. You can see there's an insurance claim to be done just like we saw in regular in healthcare. You can see the dental claim form here, not dissimilar, if you will, to what we saw before. We see here insurance claims can then be sent electronically, so we can send a whole bunch of insurance claims to a given, to one insurer. So if we have 10 patients that have insurance with a given insurer, like whatever that would be, and we can then send all our patients. We send those records directly to them. The demographics and the transformation of the industry. In the 20th century, poor care of teeth led to tooth loss by middle age. So by the time somebody was in their mid-40s, they had lost most of their teeth. Later in the 20th century, we started adding fluoridated water, and that improved the care of most people as far as their teeth were concerned. There were less dental losses, less dental caries, cavities, if you will. We saw an improvement. There was an epidemic of decay among poor children in 2010. 108 million people in the United States, including 25 million children, went without dental insurance. The aging population needs the new specialties in dentistry because our population is living longer. During Ben Franklin's time, if you will, during the Revolutionary War, the average person lived to be about 45. Now we have people living to 80s and 90s and in pretty self-sufficient manners even. So they're seeing the aging population leads to these new specialties in dentistry to help fortify and save their teeth as they age. According to the CDC, Centers for Disease Control in 2010, oral health problems are pretty common. Tooth decay affects more than 1/4 of the U.S. children aged 2 to 5, and half of those aged 12 to 15. About half of all children and 2/3 of children aged 12 to 19 are from low-income families that have decay. So those families usually don't have dental care or money for dental care, and the teeth usually go untreated. According to CDC in 2010, oral health problems are common. Excuse me, that children and adolescents of some racial and ethnic groups and those from lower income families have more untreated decay. For example, 40% of Mexican American children aged 6 to 8 have untreated decay compared to 25% of non-Hispanic whites. That's a pretty significant difference when you think about it. Also, according to CDC, children and adolescents of some racial and ethnic groups of those from lower income families have more untreated decay. 20% of all adolescents aged 12 to 19 currently have untreated tooth decay. That's a pretty damning statement when you think about it. Advanced gum disease affects 4 to 12% of adults. Half the cases of severe gum disease in the United States are a direct result of smoking, and 3 times as many smokers have gum disease as people who have never smoked. So you can see that cigarette smoking is added to that also. 1/4 of U.S. adults aged 65 and older have lost all of their teeth and have had to have dentures. African American and Mexican American adults have twice the amount of untreated decay as non-Hispanic whites. That's a very damning statistic when you see it. Now, we use some new computerized instruments in dentistry. We use the fiber optic cameras so we can get to places we couldn't get in before, electronic periodontal probe, CAD, CAM to create crowns, and digital x-rays. And we'll take a little look at that as we go through the slides. In endodontics, that's where we diagnose and treat disease of the pulp of the tooth. With the use of fiber optics, take pictures of the root canal that the dentist and patient can see, and we use ultrasonic instruments to help in root canal therapy. So we now have another mechanism to deal with that. In periodontics, which is the diagnosis and treatment of gums and other structures supporting the teeth, the periodontal disease is more prevalent in older people, and periodontal disease may be an early warning of heart disease. It is known that people with oral problems, oral disease, periodontal disease, have a much higher potential for getting not only cardiac disease, but also colon cancer. That the bacteria that are perpetuate the heart disease as well as colon cancer. So we can use the electronic probe, electronic charting to manage the periodontal disease. Here's a good look at a perio chart, it's called, to manage that periodontal disease. Another look at that. Let's just look where the teeth are at to scale them and so forth. Now, we also have cosmetic dentistry, and there's attempts to create more attractive smiles using bonding and dental implants. And dentists can use a 3-dimensional CT scan, and this allows dentists to visualize the bone, visualize the teeth to make a 3-dimensional model of the mouth. The dental implants, the technique also involves making the surface of the implant porous with an acid solution and then electronic charge, and the implant can then be more quickly fixed to the bone. A biomaterial of titanium is used as a bonding agent, so it makes it as durable as possible. Digital cameras and graphics software show before and after, so we can see that we had an improvement. Now, diagnosis expert systems, we use collections and evidence-based articles. Database of articles such as Medline and expert systems can be used as an aid in diagnosis, so it gives the dentist access to other information so they can better diagnose. We have some diagnostic tools in the dentistry world. They include x-rays, used for more than 100 years. It's more effective than clinical examination, but it may not detect cavities at their very earliest age. It also aids in clinical examination. We have digital radiography, which takes less time than traditional x-rays, uses 90% less radiation, and then images can be immediately seen and shared on the computer monitor. So instead of using the old film mechanism like in the old x-rays, they can then use this digital format. It can be scanned in the patient's digital chart, and so they can keep up-to-date x-rays, digital x-rays, of your teeth. And this is the digital image of a patient's tooth. You can see that those are put in and show where that injury is at. This is another digital image of patient's teeth, so you can see them across the board. Now, we also have diagnostic tools. For instance, we have one that's called electroconductance. Electrical current is passed through the tooth, and the resistance is measured. And it is very accurate in diagnosing large cavities, but not so much with early lesions. It's not quite as good. We use a cone beam CT scanner, CBCT. A CBCT scanner produces an accurate 3-dimensional image of teeth, so we can know what the depth of the cavity and where the injury and disease is at. That CBCT, although the use of CBCT is controversial, critics maintain that all the positive reviews are from people and groups with a financial interest in the technology. Some dentists are using CBCT scanners for planning dental implants, planning extractions, orthodontia, and to find periodontal defects, and in endodontics to measure root canals and their configuration. So they're using this technology, but it's not totally approved by the industry. Those support the use of CBCT scanners point to lower cost, more patients served in less time, and better images, and that the patient is exposed to a significant reduction in radiation than they were using the conventional x-ray mechanisms. With that said, there was a report that came out in the British Journal of Radiology last year that concluded that CBCT scans produce significantly higher levels of radiation than conventional dental imaging. So there's a lot of work to be done and a lot of testing to be done to see if that's really true. Other methodology we use in dentistry is light illumination. That's a bright light which illuminates the teeth, and decay looks much darker, so it sort of makes it stand out. We also use fiber optic transillumination, and that finds early lesions in the enamel. It's a very effective mechanism. DIFOTI, it takes images of teeth illuminated by lasers, shows direct correlation between loss of fluorescence and cavities. So it uses fluorescence to get that response. We have intraoral fiber optic cameras, which gives the dentist and patient a close-up and a view of the mouth so they can both see the injury to the tooth or what's going on up close. Now, lasers in industry are pretty significant in today's world. They're used in a lot of ways. Lasers deliver light energy, and depending on the target, the light travels at different wavelengths. So different lasers have different uses. For instance, they can be used to drill and fill cavities. They can help to reshape gums. They can have a minimal use in root canal therapy. And they also help whiten teeth in cosmetic dentistry. So lasers are becoming very preemptive in the world of treatment of dentistry. Now, minimally invasive dentistry include prevention, antibacterial rinses, fluoride, sealants, healthy diets, sugarless gum, and minimal intervention is air abrasion and laser. So those are things that can help to maintain the teeth. To use computers in dental surgery, they're used to planning surgery using virtual simulations. The delivery of anesthesia can be done by computers. Creation and planning of dental implants and monitoring of vital signs all can be a computerized process. Now, the growth of specialization, the percentage of dentists who are specialists is expected to rise from 10% all the way up to 30%. The aging population may be seeking more cosmetic dentistry as their teeth start to age just from use, and they need to be replaced. The possibility of early diagnosis may result in dentists who specialize in more diagnostic treatment. Now, teledentistry, just like telemedicine, links dentists with dental specialists via telecommunication lines. Images and records can be emailed to specialists, giving the patient access to expert advice. So instead of the patient traveling for an appointment, they send their information for the appointment, and the dentist evaluates that, talks to the patient, and they develop a plan. This has been the conclusion of the chapter on dentistry and computerization, electronic technology in dentistry. Thank you very much.